New videos every day.
Life, wisdom.
Hello everyone, this is Dr. Echols. We're back again with our two lovely ladies to help us demonstrate some of the techniques that we can use for lower back pain. This is really good for people who are having disc problems in their lower back. A disc is the actual part that kind of separates the vertebra, and sometimes if the vertebra has been out of place long enough, that disc can actually bulge or herniate backwards against the spinal cord or even the spinal nerves. That can cause pain not only in the back, but actually to radiate all the way down into the feet. So I'm going to show you a real gentle, safe technique that's wonderful for helping repair those problems, especially if you don't want to have surgery. So we'll get one of these ladies on the table and show you how that works. Here we are with Miss Mackenzie on the table, and I just wanted to show you what I'm talking about. This is the disc. These are the vertebrae here. The disc actually separates the two there, and it gives a nice space so that the spinal nerve, which comes off of the spinal cord, can come out of that hole. Now what will happen oftentimes is if the vertebra is misaligned, you may not notice that, but it'll start to cause wear and tear on this disc, and eventually that disc can bulge back at the most inopportune time and really cause a lot of pain, and that pain will normally radiate down right through here. It can sometimes come on the side of the leg, sometimes it can even come in the front of the leg, and depending upon the severity it can go all the way down to the foot, or it can be just kind of localized right here in the hip. So this is the way the vertebra would actually be in the back, and what we're going to be doing is actually flexing and distracting this spine to help pull that disc off of that nerve. This is a wonderful technique. It doesn't revolve a lot of twisting or popping, and it's able to really make a tremendous difference for some people. And we're going to get right on her back. And Mackenzie, this will be a nice stretch through here. Now what I'm doing is I'm actually getting right on the vertebra itself, and with this other hand I'm putting some pressure. There we go. And we're feeling that good distraction and traction through the spine. Can you feel that really stretching that in there? Yep, she said. Good. And oftentimes if the disc is bulging one way or the other, with this table we have the flexibility of moving the table from one side to the other so that we can reposition that disc away from the nerve. This can be very beneficial for people who have a disc problem, who don't necessarily want to go through a surgical procedure to fix it. Very good. So now we have Miss Corrina on the table, and we're going to do the same thing. We're going to get right on the base of her spine here, and this can actually be done up to a certain level up through the spine, but most of the time the vertebra that has a herniated disc is normally L5, which would be right here at the base. I'm putting some pressure forward. A lot of my weight is on my front foot as we're actually putting the pressure on my arm, and this hand is actually pushing down, and it's distracting her spine and like stretching it out. It's almost like hanging upside down, and I can really control the angle and the force very easily with doing this. And sometimes when the person's back starts to get in a little bit better shape, we'll actually put the person through more ranges of motion like this, and we'll do it all at one time. How's that feeling, Corrina?
Amazing.
Amazing, all right. I always say this is kind of like a ride. Feels pretty good. And this is a great way to help prevent degeneration in the spine. It's great for helping healthy backs stay healthy, and it's very good for getting sick backs well. All right, so I hope that was helpful. I hope you've learned something today. Corrina, how did that feel on your back?
Amazing.
Good, excellent. So this is just another tool that a doctor of chiropractic will have to get you back to feeling great again. So I hope this has been helpful. If I can be of assistance to you, please don't hesitate to contact me at www.jeffechols.com.